Dementia affects memory, thinking, and daily tasks. This module covers strategies to confusion, simplify, and reassure. Agitation. Create calm and soothing activities. Repetition. Be patient and redirect. Wandering. Ensure safety and supervision. Communication. Speak slowly and use gestures. Personal care. Break tasks into steps and be gentle. Behavior changes. Find triggers. Supporting these challenges can improve life for those with dementia. Wandering, excessive pacing, or walking about endlessly by a person living with dementia happens because of forgetfulness, restlessness, feeling lost, having a routine, seeking stimulation, unmet needs, or boredom. While it can offer some benefits like physical activity and independence, caregivers must balance it with safety concerns and support to the individual's well-being.
My father's been living with me for 2 years. He started wandering in the house, trying to go out the front door, saying he wants to go home. Oh, why is that happening? And I don't know what to do to stop it. Stop, Dad! You can't go out.
I'm gonna go home.
This is your home.
No, I'm going to my house.
This is your home. Stop.
Wandering can occur as dementia progresses. It can be triggered by someone reliving an old memory, not recognizing where they are, or by a feeling of distress. People with dementia have less ability to communicate or explain where they're going or why they want to go somewhere. Wandering can be triggered by seeing things that signal leaving, such as the front door, purses, keys, or coats. If someone is wandering, approach them in a calm and reassuring manner. Ask them where they're going or what they need, and then distract them with a new activity.
Dad, where are you going?
I want to go home.
You are home.
No, I want to go home. The kids need me.
This is your home. See? Here's a family picture. There's me and there's Tom.
But where are the kids?
I'm right here, Dad. I'm your daughter, Jane. And Tom, your son, he just lives 5 minutes away. Let's all give him a call on the phone and say hello.
That sounds nice, honey.
Okay, come on.
Wandering can still happen, even if you're the most diligent of caregivers. Use the following tips to help lower the chances of wandering. Use a calm tone of voice and ask your loved one where he's going or who he's looking for. Reassure him that he's home, point out familiar things around him, and then immediately distract him with a pleasant activity to allow him to forget his urge to wander. Disguise the door by painting it the same color as the wall or covering it with a large poster or picture. Murals for doors can be purchased on the internet. Cover the doorknob with a drape. Try placing a black doormat in front of the door. Some patients will avoid crossing the mat. Put signs on doors to discourage leaving, such as stop signs, do not enter, or keep out. Make sure your loved one is getting enough exercise. The urge to wander could be a result of unspent energy. Ask if he has any needs. He might be wandering because he feels physical discomfort or stress. Be specific. Ask if he would like a sandwich or some coffee, or if he needs to use the bathroom. Do not leave coats, hats, or keys in plain sight or by the front door, as they can trigger the urge to leave.
There are ways to create diversions for wandering. Create a comforting space for individuals to relax by cozy seating in a warm, inviting setting. Personal items set out to provide comfort. Calming colors painted on walls to reduce anxiety. Engaging sensory elements for a positive engagement. Use of safety features like handrails. Nature elements for an outdoor connection. Set up a quiet retreat area for solitude and a sense of peace and security. Provide familiar items for continuity. These spaces should enhance well-being, reduce stress, provide comfort and familiarity, safety, security, and belonging. Additionally, some senior living communities are incorporating outdoor living designs by integrating streetlights and appealing architecture into outdoor spaces. Sundowning, a common phenomenon among individuals with dementia, involves increased agitation, confusion, or anxiety in the late afternoon or evening. While its exact cause isn't fully understood, several factors are often associated with it. Changes in the body's internal clock may lead to confusion and agitation as evening approaches. Tiredness as the day progresses can increase irritability and confusion.
My father's behavior tends to get worse when the sun starts to go down. He appears both exhausted and restless. What can I do to help him get through this time of the day?
Where did I put it?
Dad, where are you going?
My checks. I can't find my checkbook.
We don't use checks anymore. Remember, I pay all your bills online. Now sit down and watch TV.
I just saw it. I know it.
There's a show coming on you like. Dad!
Sundowning, or sundowner syndrome, is a common behavior in people with dementia. It typically occurs around sunset or early evening, and it's characterized by confusion, anxiety, aggression, agitation, or ignoring directions. It can also lead to pacing or wandering. As dementia progresses, it damages areas in the brain that regulate the internal clock. This can disrupt the sleep and wake cycle and may appear as increased napping during the day and difficulty staying asleep at night. The reduced light in the evening can trigger sundowning, especially in someone who's extra tired, anxious, or who has pent-up energy from a boring day.
Dad, what are you doing?
Where is it?
You know, it is dark in here. Why don't we brighten things up and see what we're looking for?
I need my checkbook.
The checks we ordered haven't come in yet. Why don't we go look at that photo album?
Sundowning isn't a disease, but rather a group of symptoms that occur at a specific time of day. The exact cause of sundowning behavior is unknown, but there are ways to help you if your loved one displays symptoms related to sundowning. Change the environment by making sure rooms are well lit and free from shadows. Close the drapes, blinds, and adjust lighting as necessary. This should help your father understand and better prevent confusion, fear, and agitation. Create a calm environment free of loud noises or disruptions. Be patient and distract your loved one with a relaxing, enjoyable activity. Try to provide your loved one with enough activity during the day, but not so much that they become overly fatigued. Limit daytime napping to a couple of hours.
Too much environmental stimulation during the day may heighten confusion. Fluctuations in hormone levels like cortisol and melatonin may play a role. Physical discomfort or hunger may become more pronounced in the evening. Changes in lighting and surroundings can be disorienting. Staff changing shifts and saying goodbye. Overall, sundowning is likely influenced by biological, environmental, and behavioral factors. Addressing these factors can help manage symptoms and improve well-being. To reduce the effects of sundowning in individuals with dementia, focus on: offer a nutritious snack and drink in the afternoon to maintain energy levels and mood. Encourage hydration with water, herbal tea, or diluted fruit juice. Have the person rest and engage them in activities like gentle stretching, deep breathing, calming music, or mindfulness to soothe agitation and promote calmness. Create a comfortable environment with soft lighting, cozy seating, and familiar objects to aid relaxation. Provide emotional support by reassuring them of their safety and care. Use a calm tone, validate their feelings, and offer distractions through pleasant activities or meaningful conversations to alleviate distress. Sensory stimulation, use of hand lotions, and garden plants. Rummaging through things, collecting small, odd, or strange items, hiding things in rooms or closets, and hoarding any variety of items are common. Quite often individuals search through or collect items excessively, leading to clutter. Understanding these behaviors involves recognizing them as searching for things from their past or looking for familiar belongings. People with dementia may believe the items belong to them, often due to memories of scarcity. Consider the following factors. Assess whether the items will harm the person, for example, food going bad. If it's not harmful, it does not need to be addressed right away. Be respectful and kind. Offer support and encourage slow change that they can manage. If necessary, remove items when the person will not be impacted or when they are not present. Avoid criticism or judging, understanding hoarding as part of their illness. Be positive, avoid being critical, and don't ask a lot of questions. Sorting and handling familiar items from the past can be therapeutic, especially for those with dementia. Here's why. Sorting familiar items is purposeful and engaging, promoting emotional well-being. Engaging with past items can stimulate memory recall, sparking conversations and reflections. Sorting involves various functions, helping maintain cognitive abilities and enhancing brain health. Connecting current reality with personal history contributes to a sense of continuity. Manipulating objects engages touch, sight, and sometimes smell, making them engaging. Incorporating sorted items into personal spaces creates a familiar environment. Aligned with Montessori reminiscence therapy principles, it allows reflection on life experiences. In summary, sorting familiar items is a versatile and person-centered activity that promotes emotional, cognitive, and social well-being, particularly for those with dementia. Individuals with dementia may express disruptive verbalizations like shouting, screaming, or repetitive vocalizations due to fear, frustration, or confusion. They may also seek attention or connection through repetitive questions or gestures. Caregivers should recognize these emotional needs and respond with reassurance and engagement. Acknowledging and validating the person's experiences and emotions is crucial. Ignoring or dismissing their verbalizations can cause more distress and an increased risk of escalation. Caregivers should acknowledge and validate these expressions to support emotional well-being. Understanding and managing aggression involves these steps. Identify potential triggers like tiredness or hunger. Acknowledge and validate the person's emotions. Redirect their attention to a different activity. Use relaxation techniques to reduce distress. Consider gentle touch or providing comfort, like using a soft blanket or playing some calming music. By understanding the causes and emotions behind the behavior and implementing calming strategies, caregivers can effectively manage aggression, emphasizing the importance of prevention for a supportive environment. In dementia, extreme emotional responses can cause sudden and exaggerated mood or behavior changes, often leading to outbursts. Factors like tiredness, confusion, and noise in the environment contribute to these reactions. Signs include sudden mood shifts, emotional outbursts, restlessness, and resistance to care. Recognizing these signs early allows for person-centered support. Preventive measures and a calm environment can help reduce these responses. To manage these situations, prevention. Identify triggers and avoid situations that may cause a reaction. Maintain routines and create a calm atmosphere. Validation. Acknowledge the person's feelings and reassure them, even if they seem irrational. Effective communication. Use simple language, maintain eye contact, and speak calmly. Avoid arguments. Distraction. Redirect their attention to other activities or topics to help ease their distress. Aggression in dementia often arises from frustration or confusion, leading to hitting, yelling, or offensive remarks. Factors like noise, hunger, or discomfort contribute, along with fear or anxiety. Dealing with aggression requires: stay calm, identify triggers, ensure safety, redirect focus, communicate clearly, acknowledge emotions, offer choices, create a peaceful environment, meet basic needs, seek professional guidance. A person-centered Montessori approach is key for managing aggression in dementia care.
This audiovisual will show you how to manage one of the common difficult situations you may face in the care of people with dementia: those who are agitated and aggressive. People with dementia act aggressively or behave in an agitated manner in response to little or no external stimuli. Having clients yelling, screaming, and lashing out in non-confrontational situations may be a confronting experience for new staff. Jack is an inexperienced student nurse on his second day of practicum experience.
Good morning, Mrs. Green. Good morning.
Who are you?
I'm Jack. I'm a nurse who is going to help you this morning with...
What are you doing in my room? Please leave.
Well, actually, I just started working here. Like, this is my second day. I'm a student of nursing, and I was told by my supervisor...
But I always thought that
Yeah.
nurses were female ladies.
Yeah.
But you work here.
I work here. Yeah, I'm actually a student of nursing, and I was told by my supervisor that you have a wound on your leg that needs to be taken care of.
No.
And it's very necessary because
My
it's...
leg is all right. Please go away.
But can I please check it out, because it's important that we need to treat your leg?
If you have to,
Yeah.
all right.
Yeah. Yeah,
No.
Yeah.
Leave it alone. No.
Yeah, but Mrs. Green, it's really important that we're gonna treat your wound. It's...
Well,
Otherwise, the
It feels
situation...
quite all right. It feels quite right. Please keep away from there. Please leave me alone.
Let me
Please
check-
don't.
let me
No, there's
check it
no
out.
need.
Yeah?
Go away, please.
Okay.
Help me, someone help me, please. I don't know what to do. Please.
Hi, Jack. Are you okay?
No, I'm not. Like,
It's down here. What's wrong?
this lady you just sent me to, like, she's crazy. Like, she just hit me.
So do you feel you've been thrown in the deep end with Mrs. Green?
Of course, like she is just completely off the wall. She's aggressive. Like, how can you send me to her? I'm just started working here.
Jack, it can be quite confronting when we actually witness behaviours like this, especially because you couldn't work out what was going on.
Yeah, but I don't think this is normal behavior. This is just completely... She's crazy.
No, she's not crazy. Why don't we go down and have a chat with Mrs. Green together, and we can see if we can't handle this in another way.
Okay, I can give it a try.
The first thing that goes through my mind when I meet a client who is displaying behavioural difficulties is, this is not how I will define them. There may be an underlying unmet physical or emotional need that causes them to respond in this way. Having a quick look at a person's chart can give you an idea about what the issues may be. One common reason for aggression is the presence of urinary tract infections.
Hi, Mrs. Green. My name's Sarah. I'm one of the nurses. I love coming and spending time with you. Oh. How are you feeling today?
Not well, not bad.
Not bad? It's a little bit cold at the moment. Are you sleeping well at night?
Yes, I slept fine. I didn't feel the cold. I'm from Nottingham, you know.
Oh, that's right. You told me that you're from Nottingham.
Dementia patients are more than just what they are now. They are also the culmination of what they were. Mrs. Green spent 40 years teaching English in a high school, and on her good days she could beat both of us in Scrabble, even if we had a dictionary. What she is like now does not define her or the way that she will be remembered by the people who love her, so start by making them feel like they are important. Your physical safety is very important. You cannot take care of people if you are not safe. So if you are feeling unsafe or threatened, do not hesitate to leave. If you think a client may be aggressive, take time to evaluate the situation and the threat level. If it feels safe, engage them in conversation.
Very willing.
Okay. How's your leg feeling, Mrs. Green?
Well, it has been itchy today.
Do you mind if I have a look at it? We might be able to find out what the itching is being caused by. Might make you feel a bit better.
No, if you'd like to, it might make it feel better.
Okay. Do you mind if Jack has a look?
No.
Okay. Jack, just come through and have a look here. I'll just put some gloves on firstly.
I can pull this up if you like.
Oh, that would be great, Mrs. Green. Thanks for helping.
It is not always helpful to tell people how things are going to be with their care. When you ask people about how they are feeling and encourage them to ask for help, you are engaging them in their own care. Because Mrs. Green has told me that her leg is hurting and itchy, she is much more likely to be willing to allow me to remove the bandage and look at it. In fact, not only does she not resist, but she also provides me with the extra information about the itching that helps me to care for her better.
Oops, it's hiding there under your socks. Oh, that's looking a lot better.
Techniques that work once may not work the same the next time, because people living with dementia have good days and bad days, just like the rest of us. When caring for people with dementia, it is important to put effort into validating them and making sure that you know their concerns, like Mrs. Green's concerns for her itchy leg. Also, try to make sure that body language and non-verbal communication is calm, and that the way you're acting is not going to hinder the ability to build a trusting relationship. Just remember that these are people who have value. Dementia care is a specialty area of nursing. Why not investigate further to increase your knowledge?
Repetitive behaviors in individuals include asking the same questions, using repetitive phrases, constant hand movements, pacing with cleaning motions, and continuous rummaging. Addressing these behaviors involves understanding why they occur. Look for signs of discomfort. Consider overstimulation. It might be a factor. Create a calm environment, offer engaging activities, respond patiently to repeated questions like it was the first time it was asked. Offer comforting items for relief. Inappropriate sexual behaviors in dementia may involve public displays, touching, misinterpreting social cues, distrobing, offensive comments, and jealousy. Recommended interventions. If you are concerned for your safety, create physical distance and get assistance. Verbally ask the person to please stop. Never embarrass or yell. Move the person to a private area if needed, for example, if they are doing something inappropriate in public. Hallucinations happen when someone sees or hears things that aren't there, and they can be tricky to recognize. Signs may include seeing people or faces or hearing voices, especially those of deceased friends and loved ones. Also, being easily annoyed, feeling anxious, forgetting things, mood changes, talking about unreal things, and sleeping problems. Possible causes include stress, fatigue, grief, depression, medication side effects, dementia, dehydration, and psychiatric conditions. Identifying depression in individuals with dementia is complex due to overlapping symptoms. While dementia involves memory loss and cognitive decline, depression involves persistent sadness and loss of interest. In individuals with dementia, depression may appear as increased withdrawal, agitation, or restlessness, along with changes in appetite, sleep, and energy levels. Trouble expressing emotions due to cognitive decline, leading to frustration. Avoidance of social activities, leading to increased isolation. More aches and fatigue due to emotional strain. Understanding depression in dementia requires careful observation. Treatment involves therapies like medication and psychotherapy. Managing depression in this population is challenging due to cognitive impairment affecting communication and understanding of treatment strategies. Supporting someone with emotional or mental health challenges and dementia involves be non-judgmental, validate feelings, and reassure. Helping. Assist with tasks, appointments, or transportation. Understand their condition and treatments. Promote communication and regular check-ins. Respect care decisions and foster a safe space. Aid in accessing therapy or medical help. Consistent care and understanding can reduce isolation and promote well-being. To effectively handle challenging behaviors, it is important not to react. Maintaining a relaxed manner will influence the person and the situation. Always try to redirect the person by offering alternatives and choices that will reorient them to more appropriate behavior. This requires that you really know the person and their individual interests so that you can gently guide them to something different. Before we finish this module, let's go over a few questions to reinforce what you have learned today. These are general knowledge questions that we reviewed in this module. Feel free to go back in the module if you need a better understanding. For those seeking certification or CEUs, there will be questions of this nature asked in the post-test. References for behavioral challenges provide valuable insights and research findings. These resources support caregivers in understanding and managing complex behaviors in dementia. Additional references offer further reading on dementia-related behaviors. These studies and articles provide a comprehensive understanding of the challenges and strategies for care.